Bismillahirrahmanirrahim and Assalamu alaikum. Welcome to a new video about gastrointestinal infection which is called Helicobacter pylori or h.pylori. Before we started, please subscribe our channel and follow up with the further videos. Let's get started. H. pylori is a type of gram-negative bacteria that can infect the stomach lining and upper small intestine of humans. It is a spiral-shaped bacteria that can cause chronic inflammation and leading to chronic digestive problems such as stomach ulcers, gastritis, and even stomach cancer in some cases. H. pylori is typically transmitted through contaminated food, water, or utensils, and it's more common in developing countries. It can be diagnosed through various tests and treated with the antibiotic and acid-reducing medication. Helicobacter pylori is a type of bacteria that can infect the stomach lining and cause a variety of gastrointestinal symptoms. Symptoms of H. pylori, which include abdominal pain, nausea, vomiting, loss of appetite, bloating, bleaching, acid reflux, dark or cherry stools, fatigue, unexplained weight loss. Diagnosis for the H. pylori infection typically involve combination of tests such as blood test, stool test, and pre-test, and also the last is endoscopy. Blood test to check for the presence of antibodies of H. pylori, stool test to look for the H. pylori antigens, and blood test to measure the amount of carbon dioxide in your blood after the solution containing urea. And the fourth one is endoscopy, with the biopsy of directly utilize the stomach lining and collect a tissue sample for the examination. Treatment of H. pylori, which is a combination of antibiotics and acid-reducing medication. We have three common antibiotic combination include for the treatment of H. pylori. The first one is clarithromycin plus amoxicillin and plus proton pump inhibitor, which is PPI. The second, which is used, metronidazole, clarithromycin, and PPI proton pump inhibitor. The third one's treatment is amoxicillin, metronidazole, and PPI. It's important to complete the full course of antibiotics is prescribed. Even if your symptoms improve, your doctor may also recommend follow-up testing to confirm that the infection has been successfully treated. And the final, thanks for watching.